I'm a strong supporter of telehealth, and when I was Finance Committee Chairman, I helped make it a permanent in Medicare. Several states have followed suit in their Medicaid program. While I supported making telehealth permanent for all services, mental telehealth is an important tool to improve access, especially in rural America. So I'm going to give one question to Ms. Giliberti and another question to Dr. Trestman. The question, I'm going to state both of these now. Ms. Giliberti, in your written testimony, you said nearly half of the adults and youth with mental health needs don't receive treatment. Access to care can have many challenges. Has telehealth and investments in broadband helped improve the access issue? And for Mr. Trestman, in your written testimony, you said access to care in rural settings is challenging. You specifically highlighted how telehealth improves access to more timely care. Given the recent expansion of telehealth, are patients getting the best mental health care? And if not, what can we do to improve the quality of care? Mrs. Giliberti?
Yes, Senator, absolutely telehealth has had a tremendous effect on access. In fact, the story that I told, the young woman actually finally got care using telehealth. So it has disproportionately affected the mental health community. You want to have access to in-person as well, but having telehealth, particularly in rural areas, has definitely been a game changer. We need to extend those flexibilities and make them permanent. We also need to worry about licensing between states, because that becomes a problem as the emergency ends.
Yeah. Dr. Trestman.
Senator, thank you, and thank you for your work in this issue. It is enormously challenging, and as Ms. Giliberti had said, the benefits of telehealth during the pandemic have been demonstrated. They are substantial. Many people are in rural areas simply unable to meaningfully come to us without telehealth, without taking off days of work. Many don't have paid medical leave. They lose a lot of money coming to see us. The opportunity with telehealth is really substantial in providing appropriate care. The data is still evolving as to who is best served in person, who is adequately or appropriately served by video, and who is adequately served by audio only in what conditions. But in my own experience, and I still see a lot of patients, I have had insights into people's lives by seeing them in their homes that I otherwise never would have gotten if they traveled to me. So I've had opportunities that have benefited both me as the doctor as well as our patients by having access to them in a timely way, in a way that doesn't put additional burdens of cost and time on them, and that allows me to see them in the environment in which they live. Thank you.
Yeah. I've heard from Iowans about the challenges finding in-network providers, including mental health services. There are many reasons for the bad provider directories. Even the best information may not be user-friendly. Patients may have to navigate pages and pages of information. For any of you witnesses that want to comment on this question, are government regulations or incentives preventing the private sector from solving this problem? And I don't care which one of you or two of you comment on it. Okay?
I would say the lack of standardization is a problem. So, and several panel members discussed this. The fact that a provider may have to, whether it's a physician provider, mental health provider of any type, may have to deal with literally dozens of health plan requirements that come at them, different elements, different times, different submission standards, different expectations, and then have to repeat that over and over again every time something is potentially wrong. It's just a burden that they can't absorb, even the largest organizations, and that's what we see in our work. We have to fix the accuracy problem together.
Thank you, Senator Grassley.